I'm sure we all remember far too clearly just how much the COVID-19 pandemic disrupted every aspect of our lives. With quarantine and lockdown mandates across the world, overnight we began working from home, cancelling our plans, and being isolated from our friends and families. For most of us, this was a really lonely and difficult time, with the world in such an overwhelming state of anxiety. But what if I told you that during that same time, there were people actually growing their social networks, creating hundreds of new friends every single day, visiting bars and clubs and theme parks, and even socialising with their friends halfway across the world? The study I'm going to present to you today explores how social VR became a lifeline for people throughout the pandemic. I'm going to provide you with qualitative accounts from social VR users that explain exactly how and why people turned to social VRChat during COVID-19. I'm Mairi Deighan, and thanks very much for your interest in our paper today. So why did we carry out this research? Well, during the pandemic, we all became completely reliant on technology for our every need. And their use of these technologies changed. Our phones became our social lives, our laptops became our meeting rooms, as our homes became both school and workplace. So we chose to focus on virtual reality technology and explore what role, if any, VR was playing in the COVID pandemic. Now, you might be wondering, why virtual reality? Why not study our phones or laptops or smart devices? But VR technology greatly differs from these technologies in such a unique way. VR quite literally demands our attention. When you place a VR headset over your eyes, you're immersed in a virtual world and you can escape the confines of your physical environment. And during the pandemic, when we were restricted to our homes, this unique capability of VR was exploited by social VR users to allow them to socialise in an immersive and authentic way. There is a strong body of evidence beginning to emerge on social VR, but there is still so much we don't know, particularly surrounding the impacts of social VR on mental health. Our paper therefore builds on existing social VR literature, as well as gaming, health and HCI literature, by deepening our understanding of how social VR is being used as a mental health tool and the implications this has for researchers, users and developers. So the first study in our paper involved the creation and dissemination of an online scoping questionnaire. The aim of this study was to identify what links, if any, there currently were between VR and mental health. The questionnaire asked participants about their use of VR and what applications they enjoy using and why. The second part of the questionnaire was more focused around mental health and wellbeing, as we asked participants how they like to relax after a tough day and if there are any VR experiences that they use that have an effect on their mental health and wellbeing. So what did we learn? Well, from the 32 participants who answered our questionnaire, nearly all participants discussed how they used VR as a way to relax and unwind after a tough day, with over half indicating that they use social VR platforms for this purpose. Social VR app VRChat was the most commonly mentioned VR app, and respondents indicated that this app was somewhere they could go for social and mental support. These findings inspired our second study, as we were really keen to collect in-depth qualitative accounts of people who actively use social VR to improve their mental health and wellbeing. VRChat is one of the most popular social VR apps out there, and before beginning this research, I logged over 30 hours inside VRChat, understanding how the platform worked and going through the process of creating an avatar, making friends, and just really trying to understand the nuances of this platform. Once I was familiar with VRChat, we recruited participants from Reddit and from the previous questionnaire participant pool and invited them to an interview in a virtual world of their choice within VRChat. We then conducted an inductive thematic analysis and generated themes from the transcripts. So this is my avatar, and this is how I presented in VRChat when I was conducting these interviews. I asked participants about their VRChat experience, their use of VRChat during COVID-19, and the impact, if any, that VRChat had on their mental health. So what did we learn from this study? Well, firstly, we had 15 participants, and every single one of them was extremely enthusiastic and positive about their use of VRChat. Most participants passionately described how VRChat provided safe opportunities for them to socialise and be themselves. Participants explained how VRChat had been a lifeline for them throughout the pandemic, and nearly all participants explicitly used VRChat as a tool to improve their mental health. These were the 3 overarching themes that we generated from our interviews, so I'd like to delve into each one now a wee bit more. Many of our participants described noticing behavioural changes, such as becoming more confident and outspoken in social situations both in VRChat and offline. Participants also explained how the anonymity provided by their avatars allowed them to overcome their fears of being judged in social interactions. Interestingly though, some participants described how this safety led them to feel dissatisfied with some offline experiences they had. They described getting frustrated in real life that they couldn't block people or immediately transport away from awkward social encounters. They also described feeling dissatisfied with their physical appearance in real life compared to VRChat. This prompted us to discuss the potentially negative effects of social VR in our paper, which I'll touch upon a bit later as well. All of our participants reported increasing their use of VRChat over COVID-19, and many described how being under lockdown restrictions was something that actually connected users, as they described being both supported and supporting others of the larger VRChat community. Participants spoke about VRChat being the only aspect of their lives that they could look forward to during the pandemic, and it allowed them to still make plans and meet with their friends. Now, most of our findings so far agree with current literature. We already know that increased social interactions improve people's sense of well-being and connectedness in the world. We also know how avatar embodiment positively impacts VR users. However, in this study, we have identified that during the pandemic, VRChat was explicitly and deliberately used by people to improve and maintain their well-being. Similar to the account shown in the slide here, we had participants tell us that VRChat reduced negative thoughts and self-harming behaviours. We had people tell us that they actively used VRChat to practice social interactions, explaining that they trialled different methods of starting and maintaining conversations to see what worked, a practice that draws parallels to CBT exposure therapy. So what does this mean for us going forward? Well, we know that when people were faced with a global pandemic, with a worldwide crisis, they chose VRChat as a way of coping and receiving social support. While it's positive that people have found a way to overcome their social anxiety and manage and improve their mental health and well-being, we must remember that VRChat has not been developed as a mental health tool, and there is still a lot we do not understand about the effects of having a virtual social life. Further research, therefore, is warranted to explore this and also to ensure the safety for people appropriating the app in this way. So we have outlined the ways in which VRChat is being used as a mental health tool. As researchers, we must be considerate and sensitive to this environment. Developers should have an awareness of features and affordances that are essential for making people feel safe and comfortable. And we must ensure that people who rely on social VR for maintaining their mental health are considered when developing new social VR landscapes. Finally, as users, we should know and understand the limitations of social VR platforms and be mindful of over-reliance on an emerging technology, particularly if it translates to negative impacts in the offline world. In this study, we found that social VR transformed people's lives and helped them overcome loneliness and manage their mental health. Further research on the long-term impacts of a virtual social life is very much warranted, particularly in the context of growing interest in social VR at scale, as social VR presents an exciting avenue for the field of mental health and well-being. Thanks very much for listening today. We really loved carrying out this work, and if you're interested in our paper or have any comments, then we'd really love to hear from you, so please do reach out. Thank you.